Today, I am so excited to welcome Sonia Vovan to Hope Survives podcast. Welcome.
Thank you so much.
Thank you so much for coming on. So we originally connected on Instagram. Sonia has an amazing page about vestibular recovery called All in Your Head PT. And I started to see her posts on the Hope After Head Injury account, and she does such an amazing job at breaking down vestibular things and post-concussive things. She does such a great job presenting information in a way that is cute and easy to understand. And there was one post that I saw that you explained the difference between adaptation and habituation in vestibular rehab. That was the first time I had ever heard my experience explained out in a post like that. And after I saw that one, I said, I had to get her on the podcast. So thank you so much for taking the time to come on the podcast. And I cannot wait for all of the nuggets of wisdom I know you're going to share with our audience today.
Oh, I'm looking forward to this conversation for sure. And I'm so glad to hear when others can see my posts being easily digestible information like that, because that's exactly the goal of having my social media page.
So let's just introduce some of who you are. I know you are a registered physiotherapist, which isn't that the Canadian version of PT, physical therapy?
Exactly. Yep.
And then certified vestibular therapist, and you work in Toronto, Canada. And do you want to share a little bit more about who you are and why you're passionate about vestibular and concussion rehab?
For sure. Yeah. So I'm a registered physiotherapist, and same thing as physical therapist in the United States. And my certification is with the Advanced Vestibular Rehab certification through Duke University School of Medicine. And I know Emory University also provides this same type of accreditation. And basically, with that certification, I've been able to really expand my capacity to provide thorough vestibular assessments and rehabilitation techniques. And so that's kind of what happened, is that my passion for working with individuals with concussions and vestibular issues really expanded. So I wanted to learn more about it. I was seeing my patients, they were telling me how they were seeing 5, 6, 7 specialists before getting the right type of treatment. And they all said the same thing. They were all saying, no one understands how I'm feeling. No one can see it. I feel like I'm the only one who can feel it and really be able to describe what I'm going through. And I kept wanting to tell them, like, you're not the only one out there, right? Like my entire caseload is patients experiencing these issues. And so because of that, I wanted to learn more about it and be able to provide the right type of treatment and education to my patients so that I can help advocate for them when they go for their medical appointments, and I can empower them with the right information that they can use so that when they go to these specialist appointments or other appointments, they know exactly how they can explain their symptoms and be able to, get the right treatment from that.
I love that. I love how you talked about helping your patients learn how to advocate for themselves. Because one of the challenges of having a brain injury, it affects your cognition. So it's hard to describe symptoms that you're going through, period, point blank. For anyone, it can be hard to describe. I'll have doctors ask me, like, does it feel achy or stabby, or does it feel this or that? And you're like, how do I describe a headache? It's hard to put into words. And then when it's things that are more subtle and ambiguous, like visual tracking issues or balance or things that fluctuate throughout the day, depending on your fatigue or your energy levels, it's so hard to put into words. And I love that you are empowering your patients, but also everyone on social media to have a better way to explain how they are feeling. So I want to commend you for that and thank you for what you are doing in the brain injury community.
Thank you so much. Honestly, that is the initial intention and motivation for my social media page. So I'm extremely grateful to hear that.
I love that. You're doing a great job with it. So today we are going to be talking about ways to improve vestibular recovery, as you are a vestibular expert, and I'm here ready to soak in all the knowledge and ask all the questions for our listeners today. So can we just start with the basics? What is the vestibular system? It could be something people haven't really heard of, or maybe they've sort of heard of it. I know in my experience, it was, I think, 8 or 9 years after my TBI, maybe a little bit longer than that. My first brain injury was 2007. So there was there's a lot more information out there now, but I hadn't even heard of the vestibular system. And I had all the issues, but it took years to even get some sort of diagnosis. So let's just talk about what the vestibular system is and let our listeners learn everything they can.
For sure. Yeah, you're totally right. I think the vestibular system only now is really coming out of its shell, and people are truly understanding now the significance of it. But the vestibular system, a lot of people call it the inner ear as well. And that's because it's located deep in the ear within the bones on the side of your skull, so the temporal bones. And it's about the size of a quarter, so it's quite small. And because of the location of it, it certainly can be affected by a concussion. And so what entails of the vestibular system? So there is the peripheral component. So that's the part on the outside. And the peripheral component consists of semicircular canals. And basically they detect rotational movement. So whether your head's, tilting back, tilting forward, that kind of thing. And then they also have utricles and saccules, which are responsible for linear acceleration, linear movement. So that's like if you were in a car and you were driving forward and back, you're not moving, but that part of the vestibular system detects that motion. Or like, for example, when you're going up and down the elevator, again, you're not moving, but they sense that you are moving through space. And then the vestibular system also consists of the cochlea. So that's the hearing organ. And then the nerve that goes from the vestibular system to the brain. So then that's the central vestibular system now, once it enters the brain. And then it has many connections through the brainstem to the brain, as well as to the cerebellum to fine-tune movements. So altogether, that is the vestibular system divided up into the peripheral component and then the central component. And then what does it do? So basically, because of what type of signals it can sense, what type of information it can sense, the main functions of the vestibular system are related to gaze stability. So for example, being able to keep a clear image while moving your head, postural stability and balance. So, when you're standing still, it's still sensing whether or not you're swaying or when you're moving through space. And spatial orientation. So it's like being able to orient yourself to your environment and knowing how to navigate through it safely and properly. So you're not walking into walls, or if you're going up a ramp, it senses that you're tilting upwards as you're going up a ramp. And then another major function that's pretty important is related to the blood flow distribution to the brain. So because the vestibular system senses when you're, for example, lying down or sitting up and standing up, it has to make adjustments to your blood pressure and heart rate so that you don't feel, so lightheaded when you sit up or lightheaded when you stand up. So that's actually quite an important function of the vestibular system that I think a lot of people don't think about.
Thank you for explaining all of that. So what I'm hearing is the vestibular system is very important. Super important to how your body functions day in and day out. So when somebody has a concussion or a brain injury, how can that potentially affect the vestibular system?
For sure. So I think dizziness is probably like the most common symptom that people think about when they think about their vestibular system being affected. And if you think about it, I think most people who have a concussion would say that dizziness is quite a common symptom. And I think it's really only second common to headaches. I think headaches are probably the most common, and then dizziness is right up there. And again, if you think about the trauma to the head with a concussion, whether it's direct or indirect, like a whiplash injury, because of the location of the vestibular system right there and the size of it, it's almost certain that there's going to be some sort of impact to the vestibular system. Even with the indirect forces of a whiplash injury, there could be, shearing or stretching of the nerves. And those nerves that send signals about vestibular information can be impacted. So even if the vestibular system itself is not injured, those pathways can be. And so you can think about how I was mentioning, the peripheral component of the vestibular system and then the central component of the brain. There could be a mismatch of injury to the vestibular system, different parts of the vestibular system. And then on top of all that, with the whiplash injury, then the neck becomes involved. And then we know that the neck and the vestibular system and the eyes, they really have to communicate well with each other in order to feel stable. So if any one of them is off, then that's when you experience symptoms like dizziness or being off balance.
So there are, like you said earlier, a lot of different components to the vestibular system. So a concussion could affect any one of them. And so I'm just asking, so they kind of talk together. So if part of it is off, then it can kind of make more of it be off. Is that right or wrong? Or
so then you would almost say, like, let's say there's a pathway, a train pathway from A to B. If there's anything that happens along the way, whether there's, the train goes off the rails or there's something on the railroad track, then the train doesn't get to go from station A to station B. So even if station A is intact, station B is intact, anything along the way can have an impact on whether the train gets from A to B. So you can think of that as the vestibular system. So from the sensory organ in the inner ear, where it senses the information about balance and where you are in space, that information needs to get to the brain and be processed to respond to what it is that you're doing. So if there is something along that path that gets impacted, then you can experience a variety of symptoms that are related to the vestibular system.
So related to that, if somebody's had a concussion or a brain injury, or somebody's listening and they're a caregiver and they're thinking, oh, my survivor, my loved one is walking into walls and struggling with their balance, or they feel dizzy, how does somebody know if they have vestibular symptoms, and what are some of the common symptoms that could show vestibular dysfunction?
Of course, yeah. So I would definitely say that dizziness is probably the one symptom that is the most closely associated with the vestibular system. But unfortunately, it's such a vague term. It can describe such a variety of sensations. So as a clinician, I usually ask my patients, can you describe how you're feeling using any word but dizziness? And common sensations can be lightheadedness, feeling faint, rocking, swaying. Maybe I'll even ask them, are you swaying or leaning more to one side than another? Because that could indicate whether there's an imbalance of the vestibular system. So I think dizziness is certainly a very common symptom that is involved with the vestibular system. And then another very important symptom is vertigo. And I would say vertigo is probably more important because with vertigo, you can diagnose someone with specific vestibular issues if they are truly experiencing vertigo. And how to distinguish vertigo from dizziness is that vertigo is the perception that either you or the environment around you is moving. So there is some sort of movement that's happening, whereas dizziness is much more vague and much more of just a general internal unsteadiness. So using those two symptoms, I would say that that's a good start to determine whether or not someone has a vestibular dysfunction. And then, of course, being off balance, right? Because balance is kind of your body's way of integrating all of your sensory information, so to make sure that you're stable and you're able to move through your environment safely. But if you're experiencing issues with stumbling and clumsiness, or you can't walk straight, or you have to look down when you're walking because you're afraid of falling, then I think those are good indicators. But of course, with dizziness and vertigo and even balance issues, there's so many other causes to those types of symptoms. But I think with those being a good starting point, then when you describe that to your clinician, they'll be able to kind of probe further and ask you the right questions to determine if it's truly from the vestibular system or not.
Thank you for explaining that. For years, I didn't know I had vestibular problems because they would ask if I felt dizzy. And in my mind, dizzy meant spinning. Like when I was a kid and you would go to an amusement park and you'd spin around in an office chair. And so I always associated dizzy with spinning. However, I was constantly lightheaded and feeling off and feeling like I was swaying and constantly just feeling, I would always just say I'm lightheaded. And I didn't associate that with the term dizziness because for me, I just thought dizziness meant spinning. And I never experienced spinning. I experienced this general sense of constantly being off and sort of rocking and constantly walking into things. And so, Sonia, I think that advice to describe how you're feeling, to go a little bit deeper than just the general terms of dizziness or vertigo or balance, is really helpful information for our listeners to know that what you're experiencing is valid. And even if you can't put it into words all the time, trying to go throughout your day and think about, how am I feeling right now? Or I would always get bruises all over me from walking into stuff and realizing, is this happening a lot? Am I constantly walking into door frames and walls in the house that I live in? If that's the case,
exactly.
There's probably something going on. So thank you for explaining that. So you talked about dizziness, vertigo, balance. Can we talk a bit about vision? Because I know that the vision and vestibular issues can be very, very closely related.
Yeah, I totally agree. And I actually recently created a post about this because a common issue that people with vestibular issues will have is that they'll describe that their vision is blurred, or, their vision is bouncing, moving, floating. It just doesn't feel stable. And so usually the first thing that my patients will do is actually go to their eye doctor, go to an optometrist and think like, oh, are my eyes going bad? Do I need to get glasses? And so they go through the eye exam with that letter chart where they're sitting there and they're able to read all the letters. And they're like, wait a second, I don't have a vision issue per se. I can see clearly, but the difference between vision, or actually the difference between visual and vestibular issues is that with vestibular issues, the vision issues happen with head movement. So as part of my testing, I also use a letter chart to see whether or not my patients can see those letters clearly, but then I add head movement as well to see whether or not they're able to see those letters at the same capacity. And usually what I find is that they're not able to. And that's the difference. So yes, you want to be able to have, a properly functioning visual system so that, your eyes can see your world clearly, and that's considered visual acuity. But you want that to integrate well with the vestibular system so that when you're moving your head, your visual world still remains clear and well and focused.
That's so helpful. So can I ask a question? What about when vestibular type symptoms are triggered by visual movement? So because you were talking about how head movement can trigger it, but are there times that I that visual movement can trigger vestibular systems? Because I find I have a really hard time on escalators and things like that. I find that I start to get nauseous and I start to feel my balance go off, even if I'm standing still, if my vision is moving.
So that's a very, very common issue. And what I find is that if someone has had vestibular issues for a while, then your brain has to compensate in some way, right? It has to compensate in order for you to be able to function properly in your everyday life. So what it'll do is it'll ramp up the capacity of your other sensory system so that you still feel as stable as can be. And usually that sensory system that gets overworked is the visual system. So what that means is that because your vestibular system is kind of dampened, it's not functioning as well, perhaps, your visual system will have to work harder to compensate for that. So when you are in situations where you have to put an increased demand on your vision, maybe it's a visually busy environment like a grocery store where there's a lot of patterns and lights, or for example, escalators because of the movement of the stairs, or maybe a hallway with a really busy patterned carpet floor, or maybe you're watching a hockey game where there's a lot of movement, even though there's no head movement, because you already use your vision so much on a day-to-day basis to keep you stable, when you have to exert more effort on top of that to use your vision, then you can have symptoms. So that's a very common issue that happens with my more chronic vestibular patients.
Thank you for explaining that. So can we just quickly, I want to hear the difference between like what you just said, chronic vestibular patients versus somebody who maybe just recently had a concussion. You just mentioned that those issues will happen more with somebody chronically, which makes sense in my case because I've had my brain injury over 10 years.
Yeah, definitely. So at the beginning, when let's say someone has an acute vestibular issue, there is that asymmetry, perhaps. Perhaps the injury happened on one side, and so the other side has to compensate for that loss. And so through vestibular therapy, you can compensate for that loss and adapt to it. And then there are exercises you can do for that to achieve that stability again. But over time, if you haven't perhaps achieved that adaptation and achieved that, stability in the vestibular system, then something else has got to give. And so then over months and years, your brain will have to learn to find ways to get around that vestibular loss. And that could be through perhaps using your vision. So a lot of times I'll hear my patients say that they have more difficulties with their balance in the dark or in dimly lit environments because then they can't use their eyes to fixate on their environment to remain stable. Or they have to use their body more for balance. So that's called proprioception, using the sensation in your body. And so for example, my patients will describe, having to grab onto the wall and the furniture so they could have a better sense of where they are in space, or perhaps they feel more comforted if they have some weight on their bodies. So they feel more grounded if they're using a weighted blanket or something of that sort. So that's what I find is that if I'm working with a patient who's had their vestibular issues for many months and years, they've kind of automatically, intuitively learned how to get around their vestibular issues, which is quite amazing that our brains can do that for us, but it's just not a good long-term solution. So that's where I'll come in with the vestibular therapy to help, rebalance the information that's coming from all the sensory systems.
Thank you so much for explaining that. So I love my weighted blanket, and I had no idea until this moment that it was probably related to my vestibular system. So that's so interesting. Thank you for explaining that. And so I want to, before we move into talking about some more specific ways in vestibular rehab and vestibular recovery, I did want to touch on dysautonomia. You mentioned earlier that the vestibular system has something to do with your heart rate and blood pressure, especially laying down to standing up. And so do you want to talk a little bit about dysautonomia and POTS and how that is related to the vestibular system and concussion recovery?
Definitely. So I find that many of my patients with vestibular issues, they have some degree of postural orthostatic cardia syndrome. So what that means is that they have a dysregulation in their heart rate response with position changes. So for example, if they're lying down, let's say they have a resting heart rate of 60 beats per minute. When you first stand up, it's normal for your heart rate to slightly increase because it has to adjust to the position change against gravity. And it has to, pump the blood throughout the body to distribute blood flow to the brain. But it should fairly, relatively quickly come back down to your resting heart rate of 60 beats per minute. But with POTS, what happens is that then the patient, the individual, will stand up and their heart rate will increase to 30, 40 beats per minute above their resting heart rate, and often stay there even standing for 2-3 minutes. It doesn't actually recalibrate, readjust itself. And so what I've learned, and this is actually even an area that I'm recently kind of digging deeper into, is that there's a lot of connections in the brainstem related to the vestibular system and then to blood pressure and heart rate response. And so with all of those connections coming to the brainstem, they have to be able to communicate clearly and communicate properly to each other to be able to provide an immediate and appropriate response. But if there's any dysfunction in those pathways to the brainstem, then things can go haywire, right? I kind of think of the brainstem as like a central station where all the trains have to come in. They have their own schedule, their own times. But if one of them is off, then it just changes everything. So then what I find is that with vestibular therapy, once I improve the response to the vestibular system, then the heart rate response improves with those position changes. So it's quite interesting how they have that relationship.
Yeah, thank you for explaining that. So dysautonomia, autonomic dysfunction, is definitely something that can happen after concussion. And it's important to have that checked because you may not know that you have it. And I know for me, I don't have what they would call POTS because I don't faint or pass out. But I had gotten the tilt table test and the Holter monitor test and a couple other EKG through the cardiologist. And he was astute enough to notice that I had dysregulation. And even though it wasn't to the extreme level, that I had autonomic dysfunction enough that my symptoms and what was going on, and there was enough of a disparity between my heart rate on the tilt table that I did have some sort of dysautonomia. And so there are different forms and different types of it. And so finding out these things that Sonia's explaining, finding out about the vestibular system and about dysautonomia and autonomic dysfunction has been so empowering in my recovery because I realized oh, I'm not just too super out of shape. I kept exercising thinking my heart just kept pumping so much. And when I'd go upstairs, I kept feeling I was just so out of it. And I kept being like, man, I am so out of shape. And I felt such shame of no matter, I had such a hard time exercising. And then when I just felt I'm realizing, no, that's actually my autonomic system. It doesn't mean that that's not normal for everyone's heart to do that. And it made me feel better because I was
You're
wow,
so right.
I know why.
Yeah. And you know what? That's such a common thing that I hear from my patients. And then on top of that, another thing too is with the heart racing, they feel like it's anxiety, right? So they feel oh, am I anxious? I feel heart palpitations, but I don't feel anxious technically, but my body feels anxious. So it's all very interesting how it's connected that way.
Yeah. And I love that point too, because you start to think maybe it's psychological. Am I having a panic attack? Am I anxious? I'm not stressed, but I feel like my body's on edge. So it's so good to understand these things, and everyone's going to be different. However, the more information that you can learn about brain injury, the more that you can be empowered to think and connect to the right providers, such as Sonia, somebody who specializes in the vestibular system. So speaking of that, let's talk a little bit about vestibular therapy. How is vestibular therapy different than your typical physical therapy?
So vestibular rehab, I would say then, is targeting specifically those symptoms of dizziness and vertigo and balance issues that are related to the vestibular system. So the goal of vestibular rehab is to, restore gaze stability. So being able to see clearly while your head is moving, to be able to maintain your balance in a variety of conditions, whether you're standing still or whether you're moving, and then to be able to challenge your vestibular system and over time to different types of situations that specifically you encounter in your everyday life. So I would say vestibular rehab is an extension of typical physical therapy because I still have to conduct my typical physical therapy assessment. For example, I still have to assess, any pain that they have, their sensation, their muscle strength, those types of things. But then on top of that, I conduct my vestibular testing to see whether or not their symptoms could be related to the vestibular system. So then that's where the distinction is with vestibular therapy. And then there are different ways you can approach dizziness and vertigo, right? So for example, BPPV, so benign paroxysmal positional vertigo, is a common cause of vertigo. And there are certain maneuvers you can do to treat that. If it's related to gaze stability, then there are exercises for that, balance exercises. And like we mentioned before, working on the visual system and ocular motor control is important because of the close connections with the vestibular system. And overall, you just have to make sure that with vestibular therapy, you're integrating everything. So, the vestibular system doesn't work in isolation. It needs information from the rest of your body to be able to allow you to respond properly to what you're doing. So ultimately, you have to make sure that vestibular therapy is a integrated component of your whole rehab program.
I love that. So it's not isolated. You can't, like you mentioned at the beginning, the vestibular system is deeply connected. And I loved that metaphor of a train, one side could be connected to the other side, but if anything's kind of off in the middle, it could cause problems. And so you have to take kind of a holistic approach to looking at everything when it comes to therapy and rehab. So I love how you explain that. Yeah.
Yeah. And, it's one thing to really work on the vestibular system and to improve, its ability to sense information. But then let's say, what if you still have a stiff neck, right? So then that's where, maybe doing cervical treatment for the neck is just as important to make sure that all of the sensory information that's going to the brain is congruent and is sending accurate and similar information. So you can't look at, one piece of the puzzle. You have to look at it as a whole.
I love that. So the looking at the whole picture, at the full picture is what's going to help improve your vestibular recovery. What are some other ways to improve vestibular recovery?
So I think what's most important, because the vestibular system is so closely associated with head movements and body movements, the most important thing is just to remain active, right? And it doesn't have to be, like a marathon. You don't have to be running and jogging. And a lot of people with vestibular issues do find that triggering. It's just about finding exercises that allow you to be able to move safely and confidently so that you're constantly stimulating the vestibular system. So whether it's, maybe using a stationary bike because there's less of a head bobbing motion, but you still get the cardiovascular effects. Or maybe you prefer walking outside versus on a treadmill because the treadmill just feels maybe constraining and claustrophobic, whereas when you're outside, there's more space and it's open. But just to make sure to keep your head and your body moving throughout the day and to not let yourself be on bed rest for too long. Otherwise, that can decondition your vestibular system. And then on top of that, making sure that you're eating well, sleeping well, and really managing your stress, because having stress and anxiety can perpetuate a lot of the vestibular issues, right? Because it's kind of this vicious cycle where, you're dizzy or you have vertigo. So then it causes stress. But then when you have stress, it worsens your dizziness and vertigo. So if you're able to cut that cycle somewhere, and that's with either vestibular therapy targeting the dizziness or with management of your stress, then you won't have this vicious cycle that's going to constantly get you into the spiral. And so I often, from the very beginning, tell my patients, if you find that stress is a major trigger for your vestibular symptoms, then, let's work together and find the best way for you to manage it. Maybe meditation doesn't work for everyone, and that's fine. Maybe it's, breathing exercises, listening to music, spending time with your friends or family, or art therapy, whatever it is that can help reduce that fight or flight stress response in your body will also help the dizziness symptoms. So I think that that's such a crucial point that has to be brought up during someone's vestibular recovery.
Wow, that is so insightful. And, I honestly feel like the first thing to go when you get stressed out are the things that help you the most. So if you're busy and you're tired and you wake up with headaches and you're having all these symptoms, you think, at least for me, I think, well, I have to prioritize what I have to do, whether it's cleaning or cooking or showering or working or school or whatever it is, that you let the things that bring you joy and reduce your stress, like creative hobbies and spending time with friends or family, things that are really good for your mental health and therefore also good for your physical health. Those are the first things that seem to go. And so I love hearing you say that that's important for vestibular rehab too.
Exactly. I think there is that disconnect between, how can my mental health be affecting my physical symptoms? But there is that close connection. I mean, we all know what the mind-body connection is, right? So if you think about it, if your brain is constantly working so hard to keep you stable because you're feeling dizzy and you're feeling the sensation of imbalance. If you're stressed on top of that, that's just more work for your brain. And that's just less resources for the brain to deal with the dizziness. So it is so crucial to keep those self-care strategies close to you so that you make it a priority. And then ultimately your physical recovery will benefit from that as well.
That's excellent. Such an important reminder. So I also wanted to ask you about something I mentioned at the beginning, the one post that I had seen. Well, I'd seen a number of your posts, but this one really stuck out to me. You talked about the difference between adaptation and habituation. Can you explain that to our audience today?
For sure. So I think the most simple way of kind of distinguishing adaptation exercises versus habituation exercises in vestibular rehab is to think of adaptation exercises as teaching you and your vestibular system how to respond differently to an input. Whereas with habituation exercises, you're teaching your brain how to not respond to your symptoms. So with habituation exercises, you're repeating your exposure to a stimulus that is provocative and that is negative to you. So it's causing you dizziness. So maybe that's head movements. And so the goal is for you to continue to repeat the motion until your brain almost kind of ignores that sensation of dizziness. And then your dizziness will gradually reduce and, vanish over time. That's kind of like when you're sitting on an uncomfortable chair, right? When you first sit on an uncomfortable chair, you feel the surface and you're like, oh, I don't like it. But then after sitting on it for a while, you kind of ignore that feeling of your bum on the surface. So that's what the habituation exercises do, is that you're learning to tolerate the dizziness of specific movement. But with adaptation exercises, that is more specific to you moving your head while focusing on a target. So that's more commonly known as gaze stability exercises. And so the goal with this is that you have to focus on a target while performing head movements. And it's really important that the target stays in focus, because that's the signal that you're sending to the brain that you are trying to maintain that motion of that visual image on your eyes with head movement. And that's what adaptation is. So it's really important then with these types of exercises that they have to be prescribed very specifically to the individual and their issues. So, I'm finding the specific movement that causes that slip in their eye from not being able to maintain focus on the target. I'm starting with very small amounts of movement, and I'm gradually progressing it over time. So then the idea is then we're increasing the vestibular weighing of the vestibular system so that they can reduce their reliance on their vision and their proprioception, like we talked about before. And so it's more specific when it comes to adaptation exercises, and that's what really helps with vestibular recovery. And then I do find then that if there's any residual dizziness that the patient experiences that is more non-specific, but maybe it's perhaps like just general like head movements or lying down, sitting up, or turning, then I will incorporate habituation exercises afterwards. But it's really important that the primary goal should be adaptation so that the vestibular system can really adapt to that loss in signal.
Thank you for explaining that. I think it's so important. I had done some vestibular therapy years ago, and I felt like it didn't work. I felt worse, and they were just having me constantly do the same things over and over again that just kept making me feel more dizzy and more off, and I couldn't even get through the therapy appointments. Then I would come home and I would feel awful for the next day and a half, 2 days, and then I'd have to go back. And it just repeated a cycle of making me feel worse that I stopped. And it wasn't until, for me personally, my journey, I found a functional neurologist that was able to do some of these adaptation exercises and prescribed you're just going to turn your head to the right. You're not just going to turn your head all these ways because you have this specific thing. And for the first time, I personally found help. And so when I hear people either write in my support group online or tell me that they've been in vestibular therapy for 3, 4, 5 years because they're not getting better, I often wonder if maybe it's this difference between habituation and adaptation, where if you're constantly doing exercises that are just triggering your symptoms, can you weigh in on that? I mean, I'm not an expert, but doing vestibular therapy for years and years on end, is that something that should be happening, or?
Yeah, you're totally right. Is that the difference is that with adaptation exercises, you're constantly progressing the exercises to meet the demands of the patient's daily life. So the idea is that whether you're progressing the amount of movement, the direction of movement, the environment that you're doing the exercise in, it should get to a point where real life then becomes easy. That's kind of my motto, is that you do vestibular rehab until real life becomes easy. But if you're feeling like you're having to constantly do it and you're constantly doing and your symptoms aren't getting better, then there's got to be some other part of the puzzle that hasn't been looked at yet. And then that's where perhaps you have to look maybe outside of the vestibular system to see, maybe it's the visual system, maybe it's the proprioceptive system that could be still impeding the recovery. But with vestibular rehab, if it's properly prescribed to that individual and their circumstances, and it's constantly progressed, then it should eventually stop, right? So when I hear of patients who have been to other therapies where they said that they were only given a 6-week treatment block, and then that's all they got, and then they were left to their own devices to do their own exercises, then I wonder, you're not getting better because you needed more than the 6-week block, right? And you needed to continue to be pushed until you were able to accomplish your daily activities. So I totally agree with that sentiment.
Thank you for explaining that. And so our last question about vestibular system is, how do you maintain recovery and avoid decompensation? So you mentioned earlier that your vestibular system needs to be like more stimulated. So how do you, if somebody's been improving their vestibular rehab and improving their recovery, how do they maintain that long term?
Definitely. So 100% staying active is very important, because just by staying active, you're naturally moving your head and your body in a variety of ways that maintains vestibular function. But I think it's important to be, mindful and just to be aware that decompensation can happen. And, I always give that as like a disclaimer when I first start working with a patient, because I don't want them to be alarmed that, when months or years down in their recovery, they experience a setback. They think like, oh, am I back to square one again? And that's not the case. After a period of time, decompensation can happen for a variety of reasons, whether, perhaps you become ill, or you experience a moment of stress, or poor sleep, or, you get injured again and you're in bed rest, then you can certainly experience decompensation. But I find that the recovery after decompensation is much quicker, because it's almost like your vestibular system was primed already and it knows what it needs to do. So then you just have to, go back to your therapist, determine what movements or activities are provoking your symptoms, and then to just reintroduce those exercises again and again to gradually progress them until we can fine-tune your vestibular system. And so I think, again, if you are aware of potential triggers for decompensation, then if something were to happen, you know exactly what to do when it comes, so that you're not stressed out when it happens again. Or it could be that you can modify certain factors to prevent decompensation, right? So if you know that stress is a major factor, then doing the best that you can to help to manage your daily stress will reduce the likelihood of decompensation, or maintaining, activity levels, or making sure that you can sleep well. Of course, we can't avoid everything, and we're not immune to everything. So something's going to happen, but being aware is, the first step.
That's great. So what are some final words of hope or encouragement you will have for our listeners? This is Hope Survives podcast. So at the end, I always love to ask, what is some hope that you want to give to everyone listening today?
Of course. So I think, my main mission, and especially with my Instagram page, was for everyone to know that it isn't all in your head, right? That's the thing with vestibular issues, is that it's something that the person feels, but others around them can't see. And so I think that with that invisible nature of vestibular issues can be very disorienting and very discouraging sometimes. Maybe even your own family and friends don't understand it, on top of, certain specialists or other therapists may not understand it. It can be very frustrating, and it can feel like you're traveling on this journey alone. So, I just want everyone to know that it isn't all in your head, and that there are many other individuals going through what you're going through, and that there are treatments out there to help you with those issues. You just have to go out there and seek, whether it's the online community, so you can talk about what you're going through, education and resources. That's the beauty of the internet now. You have access to all of this, and podcasts like this, right? So you can learn more about what you're going through and feel empowered to kind of take this journey to the next level and be able to advocate for yourself.
Thank you so much for sharing all of this amazing information and hope for everyone. I love that it's not just on your head, that it's real. And if you're experiencing this, there is hope. there is recovery. Recovery is possible. It's treatable. You can figure this out. So for those of you listening, you're doing an amazing thing by learning, taking the time to listen, and that's the first step. And so, Sonia, people can get in touch with you on your Instagram, on your head PT. I will put that link in the description of the podcast. Are there other ways people can get in touch with you?
So that's the best way. And then I have my website, which is soniavovanphysiotherapy.com.
Perfect. And if anyone's up in Toronto area, make sure to check her out if you're looking for a vestibular therapist, because I know she'll definitely be able to help you. So
thank you so much.
Thank you so much for taking the time, and we will stay connected on Instagram.
For sure.